Imagine hearing a perfect rendition of your favorite song playing clearly, only to discover no one else can hear it. This is the reality for those experiencing musical hallucinations, one of the most fascinating yet poorly understood phenomena in neuroscience. Today, we'll journey into the mysterious world where the brain creates its own soundtrack, exploring the history, causes, and current research surrounding this remarkable condition that affects more people than you might think. Musical hallucinations, or MH, represent a unique form of auditory hallucination where individuals hear music without any external sound source. These aren't vague sounds or simple tones, they're complete musical experiences ranging from simple humming to elaborate orchestral arrangements. The music can be so vivid and realistic that those experiencing it often search for the source, convinced that a radio must be playing somewhere nearby. Unlike auditory illusions, which misinterpret existing sounds, these hallucinations emerge entirely from within the brain, creating a private concert that only the individual can hear. For some, these phantom melodies become constant companions, playing on repeat for hours or even days. The documentation of musical hallucinations dates back centuries, though they weren't always recognized as a distinct neurological phenomenon. One of the earliest recorded cases resembling MH appeared in medical literature in 1846, documented by Dr. Jean-Étienne Dominique Esquirol, a pioneer in psychiatry. Despite these early observations, MH remained largely overlooked until the late 20th century, partly due to societal stigma surrounding mental health conditions. Throughout history, several prominent figures reportedly experienced musical hallucinations. Perhaps most famous among them was composer Robert Schumann, who claimed angels dictated symphonies directly to him. These divine musical messages influence his compositions, demonstrating how MH can profoundly impact creativity. Schumann's experience raises fascinating questions about the relationship between these hallucinations and artistic genius. Did his hallucinations enhance his musical abilities, or were they early signs of the mental health challenges that would later consume him? Modern research has identified several potential triggers for musical hallucinations, with hearing loss emerging as the most common cause. When the brain receives diminished auditory input, it appears to compensate by generating its own sounds, a phenomenon neurologists call release hallucinations. This explains why nearly 20% of seniors with significant hearing impairment experience some form of musical hallucination, according to research by psychiatrist Amit Bhattacharya. But hearing loss isn't the only pathway to MH. Neurological conditions such as epilepsy or the aftermath of strokes can trigger these phantom melodies by disrupting normal brain function in auditory processing regions. Brain imaging studies have shown increased activity in the auditory cortex during episodes of musical hallucinations, suggesting that the brain is essentially playing music in the absence of external stimuli. The temporal lobe, which processes auditory information, and the frontal areas involved in memory retrieval, both show unusual patterns of activation during MH episodes, creating a neural symphony of activity that manifests as perceived music. Beyond physical causes, psychological factors can also spark musical hallucinations. Severe emotional stress or psychosis sometimes leads to MH as the brain's unusual response to overwhelming situations. These stress-induced hallucinations often feature music with personal significance, such as songs from childhood or pieces with strong emotional associations. The content of these hallucinations can provide fascinating insights into how the brain stores and retrieves musical memories. Certain medications are known to trigger MH as well, particularly those that alter neurotransmitter levels in the brain. Antidepressants, anti-anxiety medications, and drugs used to treat Parkinson's disease have all been implicated in cases of medication-induced musical hallucinations. The hallucinations typically resolve when the medication is discontinued, confirming the causal relationship. Psychoactive substances can induce similar experiences, with younger individuals more commonly reporting drug-related MH. These pharmacologically induced hallucinations offer researchers a unique opportunity to study how specific neural pathways contribute to our perception of music. While musical hallucinations can affect anyone, clear demographic patterns have emerged from research. Older adults with hearing impairment represent the largest group experiencing MH, with Bhattacharya's study revealing that approximately 1 in 5 seniors with significant hearing loss reports these phantom melodies. Women appear to experience MH more frequently than men, though researchers haven't yet determined whether this represents a true gender difference or simply reflects reporting patterns. The content of musical hallucinations often reflects an individual's cultural background and musical exposure. People typically hear music familiar to them from earlier in life, religious hymns, patriotic songs, or popular music from their youth. Interestingly, the hallucinated music often plays in a continuous loop, repeating the same melodic phrases for extended periods. This repetitive nature distinguishes MH from normal musical memory and can make the experience particularly distressing for those affected. For younger individuals, MH episodes are less common but still occur, typically during periods of extreme stress, sleep deprivation, or in connection with substance use. Diagnosing musical hallucinations requires a careful, methodical approach to rule out other conditions that might cause similar symptoms. Clinicians typically begin with a thorough medical history, focusing on hearing status, medication use, and neurological health. Since MH often co-occurs with hearing loss, comprehensive audiological testing is a standard part of the diagnostic process. Advanced neuroimaging techniques play a crucial role in diagnosis and research. Functional MRI, fMRI, allows researchers to observe the brain's activity during hallucination episodes, revealing which regions become active when patients report hearing phantom music. These studies have shown distinctive patterns of neural activation that differentiate MH from other auditory phenomena. Electroencephalography, EEG, provides complementary information about the timing and electrical patterns associated with musical hallucinations. Researchers often design specific tasks for patients to perform while undergoing these tests, such as listening to actual music or attempting to suppress their hallucinations, to better understand the underlying mechanisms. Through this combination of clinical assessment and advanced technology, clinicians can confidently diagnose MH and distinguish it from other conditions with similar presentations. While there's no single cure for musical hallucinations, several treatment approaches have shown promise. For cases related to hearing loss, properly fitted hearing aids sometimes reduce or eliminate the hallucinations by restoring normal auditory input to the brain. This supports the theory that MH often represents the brain's attempt to compensate for reduced sensory information. When medications are the suspected cause, adjusting or changing the prescription often resolves the hallucinations. For cases without a clear physical cause, psychological approaches can help patients manage their experiences. Cognitive behavioral therapy teaches techniques to redirect attention away from the hallucinations, reducing their impact on daily life. Some patients benefit from sound therapy, which uses external music or white noise to mask or compete with the hallucinated sounds. Antipsychotic medications are sometimes prescribed in severe cases, though their effectiveness varies considerably between individuals. Many patients find that simply understanding the non-threatening nature of their condition provides significant relief. Learning that musical hallucinations don't indicate serious mental illness helps reduce anxiety, which can actually decrease the intensity of the hallucinations in a positive feedback loop. The experience of living with musical hallucinations varies dramatically between individuals. For some, the phantom music becomes a constant, unwelcome companion that disrupts concentration and sleep. These individuals often report exhaustion from the never-ending soundtrack and frustration at their inability to control it. The repetitive nature of the hallucinations, often the same musical phrase playing for hours, can be particularly maddening. Others develop a more positive relationship with their musical hallucinations, appreciating the unexpected concerts or finding ways to incorporate them into their daily lives. Some even report that their hallucinated music changes in response to their emotional state, providing a soundtrack that matches their mood. Social isolation is a common challenge for those with MH, as the condition can be difficult to explain to others. Many individuals initially fear they're developing serious mental illness and hesitate to discuss their experiences. Support groups, both online and in person, have emerged to connect people with MH, allowing them to share coping strategies and reduce feelings of isolation. Some individuals find creative outlets for their experiences, incorporating their hallucinated melodies into actual musical compositions or artistic expressions, transforming their condition into a source of creativity. The study of musical hallucination stands at an exciting frontier in neuroscience research. Advanced neuroimaging technologies continue to reveal new insights into how and why the brain generates these complex auditory experiences. Recent studies using magnetoencephalography, MEG, have allowed researchers to track the precise timing of neural activities during hallucinations with millisecond accuracy, showing how different brain regions communicate during these episodes. One promising area of research focuses on the relationship between musical hallucinations and memory. The fact that people often hallucinate music from their past suggests that MH may involve abnormal activation of musical memories. Understanding this connection could provide insights not just into hallucinations but into how musical memories are stored and retrieved in general. Researchers are also exploring potential therapeutic applications of transcranial magnetic stimulation, TMS, which uses magnetic fields to influence neural activity in targeted brain regions. Early studies suggest that TMS applied to auditory processing areas might temporarily reduce the intensity of musical hallucinations. Genetic research is beginning to investigate whether certain individuals might have a predisposition to experiencing MH. As with many neurological conditions, musical hallucinations likely result from a complex interaction between genetic factors and environmental triggers. By identifying these factors, researchers hope to develop more effective prevention and treatment strategies. The experience and interpretation of musical hallucinations vary significantly across different cultures. In some societies, hearing music that others cannot perceive might be interpreted as a spiritual gift or connection to the divine, rather than as a medical condition. These cultural differences influence whether individuals seek medical help and how they integrate the experience into their lives. The content of musical hallucinations also reflects cultural background. People typically hallucinate music familiar from their cultural context, traditional folk songs, religious music, or popular tunes from their formative years. This cultural specificity provides further evidence that MH involves the activation of stored musical memories rather than the creation of entirely new musical experiences. Anthropological studies have documented cases where individuals experiencing what we would classify as musical hallucinations have been regarded as having special abilities or connections to the spiritual realm. In some shamanic traditions, hearing music inaudible to others might be interpreted as messages from ancestors or spirits. These cross-cultural perspectives remind us that the line between pathology and extraordinary experience is often culturally determined. By studying how different cultures conceptualize and respond to musical hallucinations, researchers gain valuable insights into both the universal aspects of the phenomenon and the ways in which culture shapes our understanding and experience of unusual perceptual states. The connection between musical hallucinations and creativity has fascinated researchers for generations. Historical accounts of composers like Schumann, who reportedly composed music dictated by hallucinated angels, raise intriguing questions about whether MH might sometimes enhance creative output. Modern case studies have documented contemporary musicians and composers who experience musical hallucinations and incorporate elements of these phantom melodies into their work. For these individuals, MH becomes not just a symptom but a source of inspiration. Neuroscientific research offers some explanations for this potential connection. The same neural networks involved in musical creativity overlap significantly with those activated during musical hallucinations. Both involve the interaction between auditory processing regions, memory systems, and frontal areas associated with composition and improvisation. Some researchers hypothesize that certain forms of MH might represent an unusually direct access to the brain's musical generative capabilities, essentially bypassing some of the filters that normally separate conscious composition from unconscious musical processing. However, it's important to note that for many individuals, musical hallucinations interfere with creativity rather than enhancing it. The repetitive, intrusive nature of the hallucinations can make it difficult to focus on creating new music or engaging with actual musical performances. The relationship between MH and creativity thus appears to be highly individual, with some people finding ways to transform their hallucinations into creative resources while others experience them primarily as disruptions. Musical hallucinations represent one of neuroscience's most fascinating frontiers, a phenomenon where the brain creates complete musical experiences without external input. From their historical documentation in the 19th century to modern neuroimaging studies, our understanding of these phantom symphonies continues to evolve. We've explored how hearing loss, neurological conditions, psychological stress, and medications can all trigger these vivid auditory experiences that affect approximately 1/5 of seniors with hearing impairment. The diagnostic approaches, treatment options, and lived experiences of those with MH reveal both the challenges and occasional unexpected benefits of this condition. As research advances, musical hallucinations offer a unique window into the brain's remarkable complexity, how it processes music, stores memories, and sometimes creates entire symphonies from within. For those experiencing these phantom melodies, understanding the neurological basis can transform a frightening symptom into a manageable and occasionally even inspiring aspect of their sensory experience. The study of musical hallucinations ultimately reminds us of the brain's extraordinary capacity to create rich internal experiences and the thin line between perception and creation that defines our relationship with music. Thanks for watching. Please like, subscribe, and hit the bell icon for updates. Your feedback is appreciated. We hope to see you again.